The nationwide measles outbreak has closed schools, led to quarantines, and put parts of the country under a state of emergency. Here in Indiana, there is one confirmed case of measles, and 2 more people were diagnosed with the mumps this week, bringing the statewide total to 36 cases.
And Indiana health officials are urging MMR vaccines to stop the spread of these diseases, but thousands of Hoosier families are saying no. Call 6 Investigates' Kara Kenny is digging into why some parents are choosing not to vaccinate their children.
When you enroll your child in kindergarten, the school asks for proof of immunizations. Indiana requires certain vaccines for students, including MMR or mumps, measles, rubella. However, families can opt out of vaccines by submitting a waiver for religious or medical reasons. Data shows more than 500 kindergartners submitted religious or medical exemptions for the 2017-18 school year, including both public and private schools. Statewide, by the end of that school year, 95% of Indiana students had complete immunizations. 3% were in progress, 1.5% had a religious exemption, and 0.3% had a medical exemption. That's 60,000 students without full vaccinations.
The bumper sticker slogan, vaccines are safe and effective. The reason you're seeing an increase in exemptions is because citizens know that that is not entirely true.
Melissa Safura is the co-founder of Indiana for Medical Freedom.
Parents are the ones that need to decide what they do with their own children. That is not the business of anyone.
Her group represents more than 2,000 people, many of whom are concerned about the ingredients in vaccines as well as side effects.
So it's just very important that we preserve our right to say no to what's being injected into our bodies and the bodies of our children.
Has anyone ever accused you or your group of causing these outbreaks?
Of course, that's the first thing they do.
Safura says another reason parents are hesitant to immunize, people vaccinated with MMR are still getting the mumps.
So there's a failure with that particular vaccine, the MMR.
Monroe County has 32 of the state's 36 mumps cases. Almost all who got sick had been vaccinated with MMR. At a recent news conference at IU, health officials said 1 dose of MMR is 78% protective against the mumps, and 2 doses is 88% effective. 2 former Merck scientists filed this federal lawsuit accusing the maker of the MMR vaccine of falsifying test results and overstating the effectiveness against the mumps. We took our questions about MMR to the medical director of infection prevention at Riley Hospital for Children.
The more people that are vaccinated, the better the community is protected.
So you're saying it's still better to have it than not have it?
Yes, if you just look at the number of cases of mumps that are reported in the United States, it's very small compared to how it used to be.
Dr. John Christensen also points out MMR is extremely effective against the measles, 97% with 2 doses, according to the CDC.
I have had a star soccer player from a city here in Indiana die of measles encephalitis, preventable disease.
Was he vaccinated?
Unvaccinated.
Dr. Christensen says there are some legitimate reasons to refuse vaccines, such as a compromised immune system because of cancer.
My child's arm hurt after the vaccine, that's not a good exemption. Or, for example, given an exemption because, he was tired for 2 or 3 days, that's not an exemption.
Christensen says there's an entire industry that will help families get out of vaccinations.
But there are many people who declare a religious exemption and nobody questions it, okay? And that's where some of the problems lie. I've become a believer throughout the years that having mandates and taking away exceptions, it may be a good thing.
It's too easy right now, you think?
It is too easy.
Call 6 Investigates reached out to the maker of the MMR vaccine, Merck, and they told us the vaccine has proven its effectiveness by dramatically reducing these diseases in the United States. The lawsuit filed against Merck is still pending 9 years after it was filed in federal court. Merck says the scientists' claims about MMR have no basis in fact and are without merit. In addition to required vaccines, Indiana also has a list of recommended vaccines, including the flu shot and HPV. If you have questions, you can talk to your doctor or research on the FDA's website. Kara Kenny, RTV6.